In my career, I've worked with a lot of great administrators, and many of the best ones that I've worked with have a clinical background because they've actually been at the bedside at some point in their careers providing care.
As far as healthcare, most of us lay people need it, we don't pay any attention. And Jimmy lives it and breathes it. He's turned that hospital around. I've watched him make the rounds to talk to patients. He knows out of about 218 employees, he knows every one of them by name.
At Wagner Community Hospital, he's brought us from a ground zero point to a thriving healthcare facility that cares about the community.
I received a phone call, because we were with that about 18 months without a formal CEO. I received a phone call, and there was Jimmy on the line, introducing himself, asking about the position, saying he was from Hope, Arkansas. I thought, wow, there's hope.
We were sort of faced with just completely shutting down our operating suites. Now it's thriving. And I think that's what Jimmy has been very good at. And I think he is very good at physician relations. I think he has been very good at bringing in the specialists that we need to do what we do.
Jimmy is a very passionate person about everything, his job, his family, his faith. So it all transcends into the workplace, and the staff feels that Jimmy's commitment to everything he does.
From our maintenance department to the physicians, to the cafeteria staff and the nurses, they trust him and they trust his judgment. Jimmy's a serious man. He has a serious job, but he's lighthearted, and I think he enjoys having fun with the people that he serves in the community.
Jimmy will try to make patient rounds virtually every day. Now, he may not see 100% of the patients every day, but he goes to visit patients and family, and they are very surprised that the CEO would make and take the time to do that.
Well, Jimmy has taken a strong advocacy role at the state level, not only locally, but Jimmy is one of our leaders who routinely can be seen in the hallways of the state capitol, visiting with our elected representatives.
There's a cliche that all politics are local, and I believe that. And I think that CEOs should have a very tight working relationship with our legislators.
That's the way Jimmy is. If you'll take the time to listen, Jimmy will educate you on what he does, what the hospital does, what it provides for the community.
And while we may not always agree and see eye to eye, at least we should have a voice, and they should understand where we stand on healthcare issues.
Jimmy's also well known for his love for rural healthcare. Not only does he live in a rural community, but he leads by example in trying to improve healthcare with all his rural community counterparts.
Jimmy has seen the ups and downs of healthcare and the transition that the field has experienced. And the impact on rural healthcare has been exceptionally intense.
We are also one of the last few independent public trust hospitals that have no system affiliation. So you can imagine how difficult it is sometimes to make the hospital successful. The old cliche that surround yourself with good people and you'll do fine, I think is absolutely correct. We have a great team, and my role is to coach them and then kind of stay out of the way and let them do their thing. And they do a great job at it. I'm so proud of the staff that I work with at Wagner Community Hospital.
And he's a benefit to Oklahoma, to healthcare, and selfishly to Wagner, Oklahoma. So I'm proud to know him.
In the spirit of Cleve Rogers, who was a rather quiet leader, but terribly intense in terms of his relationships with other individuals and making visits across the state, I can well recall that. And I think Jimmy embodies that in a great way. His own quiet leadership, the networking that he has done across the state, and particularly reaching out to new CEOs. I think Cleve Rogers would be proud. I certainly am proud. And
it's very easy for CEOs to be in their shops doing their thing day in and day out while the world is changing around them. and the industry is changing around them. So to be involved in the association and working with people from the staff at the OHA and CEOs and leaders across the state, all for a common cause of improving our industry, keeping our hospitals strong, and improving the health of Oklahomans, is very, very rewarding.